Okay, very good. We'll start with you, Liz, to just maybe give a bit of an overview of what the city does to promote health and wellness as we think about all the different factors that go into obesity.
Yeah, thank you. So I will say that I can speak for Food and Nutrition Services, which is, one piece of really what we think about as a district with regards to students' health and wellness. But for our department, our main focus is on serving meals that meet USDA regulations for school meals and the dietary guidelines for Americans, and eliminating ingredients in these meals that have been shown not to be promoting of good health by scientific and peer-reviewed studies. We also, try to accommodate any students with special dietary needs and provide information on our meals on our website. We are really, supportive of promoting participation amongst our students, and all children in Baltimore City Public Schools can eat breakfast, lunch, snack, and supper for free. We also have a fresh fruit and vegetable program at around 90 of our schools. And we really do want to do a lot to promote consumption of fresh fruits and vegetables amongst our students. That is so important for student health. We also do try to look at where we purchase our food. And so we look at, prioritizing purchases from local farms within 200 miles of Baltimore City. And we try to do education around the link between school meals, farming, and the environment in our students, and really connecting that not just through visits to our Great Kids Farm, but understanding the real link between that from composting and disposal of our materials to what the agricultural economy and the impact of local purchasing looks like, as well as what is currently seasonal. And then the last thing is we really try to reduce food waste and the impact of our operations on the environment through sustainable operations. So we serve, during a regular school day, over 90,000 meals a day at 170 or so locations throughout the city. Right now, we're operating in 83 schools throughout the city, and we're serving around 30,000 meals a day. So the impact of our operations is significant, and we've made a lot of effort towards moving to more sustainable packaging materials for our meals, as well as utensils and cutlery.
So there's still a lot going on with the pandemic even.
Absolutely, yeah.
Great. Great, I wanna just bring in Michael for a minute and to talk about community schools. I know you were integrally involved in a community school in Baltimore City. How do you see the role of community schools on top of the core aspects of food and nutrition that Liz just talked about?
Yeah, so I think to start the conversation, it's really important to define what in fact a community school is. And in order to understand what a community school is, I think it's important to understand what a traditional school is, because that's what a community school is not. And there's an analogy that I like to think about that uses like a telephone essentially to understand the difference here. And a traditional school is kind of like your rotary phone. It's that old school phone that doesn't really offer that much. It just allows you to speak with somebody and really not get too far beyond that. When you think about a community school is kind of like your brand new smartphone. It's a special place. It's based on the idea that in order for students to be successful academically, you're going to have non-academic needs, both students and their families, that are identified and then they're addressed. And so you're this school, but you're this school on steroids. You're a phone, but you offer so much more. And so in a community school, you're going to have somebody, at least one person in the building, who's often called a community school coordinator, who's going to work to develop different types of partnerships, bring in resources that are going to help the school integrate things like academics, health, social services, youth development, community engagement, things like that. And the hope then being that if you integrate all these areas, that you're then going to see improved student learning, stronger families, healthier communities, things like that. And so again, like if I'm going to keep on going with this tired analogy of the phone, you think about what types of apps that smartphone offers, right? And you think about the fact that you can personalize an individual smartphone for the particular user. And so what are those apps that exist? And then how do you determine what apps are needed for that particular phone or that particular school? And so again, when we think about partnerships, when we think about programs, you have to identify those needs. And so in a community school, any community school that's doing their job effectively, they're going to be completing needs assessments on a regular basis. And a needs assessment within the context of Baltimore, which is obviously what I'm most familiar with, involves surveys, it involves focus groups, it involves one-on-one interviews to determine the specific needs, not of the city, not of the neighborhood, but of the specific people who are going to that school. And when you're doing that, what you're really doing is you're listening to families, you're listening to everybody who's connected to the school, figuring out what they need, what they want, and really like where there is that overlap. And so from the needs assessment, you're going to have a coordinator who's working with school leadership, who's going to develop partnerships with outside organizations that then come in to engage students and families in meaningful ways. And I think what's really important when we're thinking about combating obesity and thinking about wellness is that you're not looking at kind of a national organization necessarily to come in and implement a program. You're not necessarily looking at a curriculum. You're looking at very specifically tailored organizations that are specifically tailored to meet the exact needs of.
Great. So could you give us a couple examples related to obesity where you think that might be relevant?
Yeah, absolutely. So I've seen examples, if we're thinking about Hopkins and we're thinking about Baltimore, where volunteers, let's say, from the School of Nursing have been brought into early childhood education classrooms and worked with pre-K, kindergarten, first grade classes on a regular basis to teach kids about health-related topics. They've done nutrition and physical fitness classes. You can see examples of schools that partner with local neighborhood associations, and they come in and they might support the fruit and vegetable program, for instance, that Liz was referring to before, or they might come in and do work on a school garden and kind of supplement what's already going on there. There are a lot of really good examples.
Great. I want to bring in Kate. Thank you so much for joining. And we went from every school, hearing about what's happening at every school with this Marchetta, to this community schools with Mike Glenwick, and talk a little bit about the intensity of the Rail Center, perhaps, and any other initial insights you want to bring to the question of obesity in schools.
Sure. Yeah. Thanks so much for having me. So for those who aren't familiar with the Rail Center, its full name is the Ruth and Norman Rails Center for the Integration of Health and Education. And the flagship project of that center, which is a partnership between the Rails Foundation and the Johns Hopkins Children's Center, as well as KIPP Baltimore, which are two public charter schools in the Walbrook neighborhood in sort of the northwest portion of the city, is a partnership that creates, implements, and rigorously evaluates comprehensive integrated school health and wellness programming. And so what we do at the Rails Center is try our best to implement all of the components of what's known as the WISC model, the whole school, whole community, whole child model of health and wellness. And that model is designed to bring public health principles and a whole child approach to education together. And so the WISC model is really, I would point folks who are interested in kind of comprehensive population-focused, multi-component interventions around nutrition, obesity, and physical activity to the WISC model, because it really maps out where all of the components of those interventions need to hit in order to be really impactful within schools. And that's everywhere from the food and nutrition services and environment to the health curriculum to the kind of partnerships and service delivery folks that Mike is alluding to. One of the big components of our program is wellness. And I'm here, I think, specifically to talk about sort of health services in schools. Thank you, Josh. So we all, in addition to our wellness programs that are sort of whole school preventive approaches, we deliver health services. So we operate comprehensive school nursing, as well as what's known as a school-based health center. So school-based health centers are essentially pediatric practices within schools, and their goal is to promote improve health and educational outcomes for kids by removing access barriers to primary and preventive care services and to keep kids in school and learning. And school health programs are really great ways to implement obesity prevention programming in schools because schools are really trusted hubs in their community. So that's I won't speak for Mike, but that's kind of the idea behind community schools, right? These are places where kids spend a large amount of their time. Many families and family members spend a large amount of their time there. And they often have very sort of trusting relationships with families and communities, particularly in communities that may feel marginalized in other areas and may feel most comfortable coming to schools for services. And those schools, as Mike alluded to, really tend to know their kids and communities well, particularly those who have the benefit of a community school coordinator. So the idea is to bring all of the services that kids and families need into that existing hub. So one of the ways that we do that at the Rail Center is by providing these enhanced health services right in the school building. And so in terms of nutrition and obesity, there are a variety of things we can do. Certainly the types of whole school interventions that bring education around nutrition, that bring increased physical activity, that screen kids for elevated BMI, et cetera, can be implemented across schools. But also high quality obesity management services and diabetes prevention services, clinical services, can be delivered in the school setting. And this can be done in a way that removes the kinds of typical access barriers, right? So if I'm a parent and I have to work a couple of different jobs and I'm a single parent and I have 3 kids in school and I take my child to their annual well visit and the pediatrician says, I need you to come back in a month because we really want to engage around this issue of weight management for your child. I have to prioritize that with taking off of work from my hourly job, my child missing school, et cetera. If there's a school-based health center in that child's school that can provide similar services, and the child just has to walk down the hall and the parent can talk on the phone and we can be really flexible about how we deliver those services, I may have better adherence to that kind of management and treatment plan, better engagement, be able to know that family and child better, and connect them better with services right there in their school that can help to support them beyond the clinical care. So that's just sort of one example of the ways that we can deliver enhanced clinical services in addition to these sort of preventive interventions within school settings.
Great. Well, that's great. Well, what a good start to the discussion. We heard about some nutritional approaches, food access that touch every single child in Baltimore City schools. And we heard about the community schools and their flexibility to support particular needs in different communities. And then we heard about the Rail Center, which is very, very intensive. It can actually provide clinical care to kids. So you can almost think of it like a pyramid, from the more universal access to the extremely specialized. Schools have tremendous reach for this challenge. And of course, kids are spending a huge amount of time in schools. And so it's both what they're eating, the time they're spending, what they're learning, and the engagement of their families that all contribute to this, this opportunity. I think I want to ask a few more questions, and please put questions in the chat or raise your hand if you want to ask one to this great panel. But I think I want to go back to Liz Marchetta and ask her how you assess how well all these different initiatives are going. What are your goals and where do you see things headed?
Yeah, so, we have a couple of different, ways that we look at the data that we have. So, during a regular school year, we would probably look at the % of our students that are eating at individual schools relative to the total number of students enrolled. and we'd look at that. We've done things like plate waste analyses where we'll actually separate out the waste generated to see what kids are actually eating. Because as we like to say in our department, we don't want healthy trash cans. So it doesn't really matter if we're serving a meal that meets USDA's regulations, that has that fresh fruit or vegetable on there, that has a side salad, if a kid is just going to throw that right away. So we do try to think about what makes it easier for kids to actually eat. So for instance, slicing our oranges is a must, because if that does not slice, it's probably going to be used as a tossed into the trash can. Same with salads, having a side salad present is one thing, but actually putting that, spinach or lettuce onto an actual sandwich with some lettuce or onion and tomato, that is, additional ways that we try to actually get that produce into kids. So, another thing is that we actually have a farm that is part of our school system and department and exists as an educational resource for students. So we do a bunch of field trips out there, and that has actually been moved to an online virtual format during this time, and it is aligned with the second grade science curriculum about what plants need to grow. So we also will do, assessments of, teachers' experiences out there, children's experiences out there. And we, really do try to tie that piece to the larger educational goals, but also understanding that healthy eating is a very, complex issue in many ways. And, there's different ways that we need to look at it, not just through, one, participation rate or the number of meals that we actually put out there.
Well, it seems like there's a lot that you're looking at. I can give you a little feedback from my own experience that we learned some about nutrition from our kids in the Baltimore City schools. At one point, my son looked me straight in the eye and said, Mrs. Goldman, who was one of his teachers, said that if everyone knew what you put in my lunch bag, you wouldn't be the health commissioner anymore. So that was a little bit of a wake-up call that we needed to do a little bit more healthy food for his lunch. And I do think that you can influence kids both by what they eat and what they understand in schools, and the city has made a lot of progress there. Maybe I'll turn to Mike. How does, you talked about the fact that it's not one size fits all when it comes to community school and that they're different neighborhoods. How do different, community schools handle this differently? And thinking particularly about, for example, in Baltimore, the challenges in the Latino community.
Yeah, it's funny. I was talking with a former community school coordinator who had once worked in a school that was probably 85 or 90% Latino, a little bit about this conversation. And she said, the food landscape within schools is steeped in colonization, or rather in the US is steeped in colonization. And when we're thinking about Latinos in the United States, we're thinking about healthy eating, I think it's crucial to remember that Central Americans and Latinos had found the perfect diet long before they ever came here, right? And so when we're thinking about what Latinos want and what they know that they need, it's crucial to listen to this combination of what they want, what they need, what they can afford, and things of that sort. And our families know how to eat healthy in many situations, in many circumstances. They know that rice and beans and corn can make the foundation of a perfect diet. They know that vegetables are crucial. And so when I've talked with community school coordinators about how they support families, particularly in Latino communities and in Southeast Baltimore, which is where I have a lot of my experience, they want fresh produce. Coordinators have done surveys of families that say specifically that they cook their own meals 7 days a week. And so then when you have outside organizations, let's say the Maryland Food Bank, that runs a number of different things like their school pantries, they run a thing called the Heart Market, programs that I'm sure Liz is very familiar with. And coordinators will tell the folks that run these programs, we don't want cans for our families. We don't want canned whatever, because that's not what our families want, and that's not how they deserve to live. Again, as we're talking about the community school strategy, partnerships are so important, and so many schools have amazing partnerships with outside churches, different type of faith-based organizations, that as long as they know what families want, if they know that they want these healthy items, they'll be able to provide them, but they make assumptions to the contrary, and then that obviously has negative repercussions.
Got it. So, and feel free, others can jump in. I do want to ask a question for Kate, which has to do with the particular challenges, since we're talking about childhood obesity, and we know that somewhere in the order of maybe 25% or more of kids in Baltimore might qualify as obese. How does that, when you really have this intense, pediatric model in the school, how do you tackle that, at a school level? What are the approaches that can be brought?
Yeah, so, as folks here well know, this is a broad multifactorial issue, and that individual level sort of behavior change is not the long-term solution to childhood obesity. So that's where partnerships within schools that offer the kinds of programs that Liz and Mike are talking about, where there is a food pantry, there is health and nutrition education, there's a rigorous physical activity and structured recess program, physical activity and brain breaks in classrooms, and just sort of a culture of health, wellness, and nutrition is a critical first step. Some of the things that we're doing, we currently at the Rails Center have a grant that's funded by the Community Health Resources Commission. And for folks who are interested in childhood obesity, and particularly the intersection between schools and childhood obesity, the CHRC funds a variety of programs, school-based health centers in particular, related to their ability to address the goals outlined in the state's diabetes action plan to prevent the development of diabetes and to address childhood obesity. And as a part of that project, we are implementing a sort of population level intervention that involves all of the universal school interventions we just talked about, partnering with the food pantry and partnering with physical activity and nutrition teachers to deliver evidence-based lessons and modules that promote physical health and nutrition. We also are then implementing or continuing to implement fitnessgram screening, which, as many of you may know, is a program that is done through physical education classes and identifies, there's measurement of BMI, but also fitness testing to identify kids who may be in a health risk zone, either because of their fitness level or because of their BMI. And through that program, we're identifying kids who are overweight and obese and conducting outreach through our school nurses to listen to families, to hear from families about what, if any, concerns they may have related to their child's health and nutrition, what their sort of previous understanding or recommendations about their child's health and nutrition might have been from, say, a primary care pediatrician, and what, if any, services we may be able to offer them. So in many cases, those kids are then getting referred to the school-based health center. There are 16 school-based health centers in Baltimore City. Ours is just one of them. We are operating this specific program, but other school-based health centers have similar programs. And many of the school-based health centers in the city are open for both in-person and telemedicine visits, even during school closure. So as part of our intervention, when we see kids in the school-based health center, we are first ensuring that we're doing screening for food insecurity and linking kids and families to our food pantry at the school and other food and nutrition assistance programs to make sure they have access to that healthy food we talked about. And then we're using sort of evidence-based clinical guidance to promote individual level behavior change, but also to provide education and information about physical activity and nutrition, to screen for complications of obesity like the development of diabetes, and to refer kids to multidisciplinary weight management programs such as the WaySmart program at Mount Washington Pediatric Hospital when that's needed. And because we know access can be an issue, we have a family advocate who works closely with kids and families to help them get transportation to visits, to set up video visit appointments, to complete referral processes, et cetera.
And Kate, one quick follow-up. Do you have a sense that you're making progress on this topic? It's a hard one to make progress on. So how would you, quickly just sort of assess that?
Yeah, it's a really tough thing to make progress on. This project I'm describing actually just started. So I'll share with you some results, hopefully in 6 months to a year. But the ways that we're looking at that is really, we're gonna be tracking, first some process measures, just like, did we create and deliver these nutrition and physical activity interventions? We do track physical activity minutes in the classroom and have seen that that has increased substantially since the Rails Center partnership.
No.
And we will look at outcomes around screening for food insecurity and completed referrals to the food pantry, as well as tracking completed referrals to multidisciplinary weight management, and in the long run, our kids' BMIs. But we know that that's sort of a downstream indicator in this area that takes a lot longer to move.
Great, thank you. Well, I want to go to some of the questions in the chat. And Brian Bordley, would you be willing to unmute and ask your question? And maybe introduce yourself? Brian, you see your picture there. There you go.
Good morning. Good morning. Good morning. I apologize. I'm driving at the same time. I like the conversation. We've had numerous conversations with various schools dealing with the Latino and African American population. Currently, we're in Curtis Bay, Pimlico, and Belmont, trying to create a stronger wellness approach plan. We have wellness coach services that have been working great with the parents, and now we're trying to see how to integrate it with the youth. We have a culinary program that allowed kids to cook with a renal chef to understand how to prevent diabetes, high blood pressure, and obesity. That was very successful for the last 2 years. My question is, how do we create more community engagement? We ran into so many obstacles with various schools not really wanting the information or even the services, and it counter contradicts what we're trying to do.
Got it. Great. And tell me the name of your organization.
One More, One Less Mentoring After School Youth Program.
Great, thank you. So great question. There are, community organizations that want to, pitch in, develop. What's the process for that? Maybe Mike, this is a good question for you. I'm sure, you had to figure out how to arrange partnerships, and what are the challenges, and what advice would you have? Mike, are you able to unmute? You can't unmute? Uh-oh.
Let me try right now.
Let's see. Can you unmute Mike?
All right.
All right, excellent.
Yeah, so I think first, Brian, it's awesome that you guys have been doing that already at a number of schools in the city. And it sounds like you're off to a good start with that. My kind of measured pushback is that I think there are a lot of schools that do want that type of programming and that they do welcome those opportunities. I think what I think is crucial to consider here is that schools are often overwhelmed, that staff are at 150% capacity at all times. And so one of my suggestions would be to look to fit in or collaborate with structures that already exist to support programming. So the after school model is a perfect example of an opportunity or a space where it seems like some of your programming might be a perfect fit. You're looking at an organization that's already pushed into a school, that already has relationships with school leadership and families and students, and then you're able to offer your programming within the context of that.
Great, thank you. We have a question from Christina. I don't know, Christina, if you can unmute and ask.
Hi, yeah, I'm Christina. So my question, so I work as a data analyst for the Office of Food and Nutrition Services in New York for the Department of Education.
Mm-hmm.
So my first question will be related to like the menu planning. So how do you design your menu in order to accommodate like different cultural aspects? My second question will be related to your health education programs and yeah, how they are implemented in your school.
Great. I think that for the first one, for sure, is a question for Liz.
Yeah, so I personally do not design our menus. We have two dietitians actually who, work on that. I will say there are a lot of restrictions and regulations around USDA school meals that, in some ways are really excellent in trying to reduce, just the total number of calories, the amount of saturated fat, the levels of sodium, which we know need to be reduced in the food that people are consuming. In terms of actually looking at like what is relevant culturally, our menu planning team, I think, does a really good job at trying to, work within USDA guidelines. But there is the restriction of really having kind of one menu that needs to be adhered to across the district. And I will say trying to get 180 cafeteria managers to follow a menu consistently can be an operational challenge. But we also give a lot of, I think, autonomy to our managers to really know what is being served to their students and what students are actually taking. So every day in their cafeteria, they will be completing a production record that shows every type of fruit or vegetable, every, sandwich that is being served, if it is a pasta dish, if it is rice and beans, anything that is being served out there for students, is being tracked. And then we will actually look at what is taken and our leftovers. So we really encourage our managers, to use that to then make their projections so that they're actually feeding what kids are actually taking and interested in.
Got it.
Do a lot of taste testing among students too, at different schools to try to do that. And we have really tried to mix up the number of, I would say, plant-based protein options to get more beans in there, just because we know that is great. But there's also, the need to, I think, adhere to one menu at large. So we create several options. There's several different choices for entrees. That's a little harder to adhere to now that we're in a mostly to-go environment where families come to schools, pick up meals and go. But there are also the opportunity when we're in a regular school year and kids are actually coming through a cafeteria line to, pick and choose what they want to get off of the menu so that they're not forced to take things that they don't want. Because we're at the point of serving things and, letting it go with families, we have a little bit less choice around that. And then we're also trying to do produce boxes for our fresh fruit and vegetable program. And that, we'll get things that are from a little bit further south at that point, because, apples can only get you so far, but that is really the fruit that is available to us in Maryland throughout, until pretty much March. So, we do try to mix it up a little bit. We do have a procurement requirement that all of our items must be sourced from within the United States. So that is another area where, you can only find, so many different types of fruits and vegetables that are growing, so that's a challenge there.
Now the second part of the question was about healthy food kind of education. And is there a single curriculum that cuts across the schools, or is it that each school has, has flexibility to pick a curriculum, or how does it work in Baltimore? I don't know if anybody knows the answer to that here.
So there is, something for food and nutrition that is included in the health curriculum for students, and I'm not the most familiar with that. I will say that we are trying to work to promote its integration across different subject matters, because it is not just health, health class and how we think about it there. It is science, it is math, and what it means to actually, put together a recipe and scale that up or down, what it means to think about where the food comes from. These are not conversations that should be just limited to health class.
Thinking about orange pieces or math for sure, at different levels of complexity. Any other thoughts about that question from the other panelists? Kate?
Yeah, I would just add there are, the city has health and wellness standards that each school has to achieve and demonstrate that they are somewhere in their curriculum implementing them. And so, as Liz said, that's designed sort of purposefully so that they can implement it across the curriculum. But there are different schools that have different levels of sort of penetration or uptake of a true like health class. And so there tends not to be one single curriculum that is used across.
Great. And I wanted to get back to Liz with one question, which is how do you assess overall? I mean, the amount of measurement you're doing is impressive because you're looking at food waste versus, all the different types of food that are being picked. How do you assess overall whether, you're making progress on the diet issues? Are you looking at like the pounds of fruit and vegetable that are, consumed every year per capita? Like, how do you think about that from a, running the whole program point of view?
I would say it's a difficult conversation, and it's really in some ways limited by what can you actually measure. So, as someone that likes to look at different sources of data, I like to look at the youth risk and behavior survey, because that I think, looks at that. There's only so many programs that are really going in and doing things like actually, taking health metrics and tracking those and working with families on that kind of, detailed level. So in many ways, we're limited to what we can measure. And certainly doing a waste assessment takes time and effort, and you have to separate things out. So we do also try to look at best practices because we're certainly, for better or worse, we are a federally sponsored program, but there are many districts, every public school system in some ways is in the same, box as we are. With this, and people implement it in very different ways.
Great. I want to make sure people can know to still put their questions in the chat. And Sana, are you on still? I don't know if I see your name. Oh,
Hi, yes.
Yeah, feel free to turn on your camera if you want or not, and please ask your question.
Yeah, I'm outside. I'm not able to turn my camera on right now, but I just put in the chat, I was actually a public school teacher in Jacksonville, Florida, in a Title I school where pretty much 100% of my students were on free reduced lunches. So I would help give out breakfast in the classroom. I would walk them through the cafeteria line and kind of saw the quality of the food that was being given out to them, which of course by USDA standards, they meet those standards, but my kind of policy was if I wouldn't personally want to pick that up or eat it, then students shouldn't be served that food either. And I saw that a lot in my students. They would not like the food, or they would bring in their own snacks, chips, soda from the local corner store because they don't really have that access to local fresh food outside of school either. So my question is kind of, how are these communities, low income, under-resourced, historically marginalized communities, specifically being prioritized in the distribution of our healthy local fresh foods?
Great. Anyone particularly want to answer that question? Liz?
Yeah, thank you for that. And I saw your comment in the chat, so I appreciate that you have been engaged in helping feed kids in classrooms. And I would say with things like fresh fruits and vegetables, and just all meal service in general, we are fortunate enough in Baltimore City to be in the community eligibility program with USDA, which allows us to serve all kids for free. So we do not require students to fill out an application to access our meal services. And right now, there is no documentation, there is no identification that is required for families, students or adults or youth under 18 to pick up any meals. So, I would say that is, kind of the baseline of where we are at. We are offering boxes of fresh fruits and vegetables at all of our meal sites, and we have really tried to prioritize the location of the meal sites for this year in areas that have low access to fresh fruits and vegetables, high levels of poverty, low levels of transportation, and areas that we know that we have, involved, communities and people that have expressed interest in this. So there are district surveys that have been done over the past 6 months as the landscape for education has changed so dramatically. Unfortunately, we can't even attempt to do really, I would say, online meals, although I will say that, USDA did do the pandemic EBT program, which gave about $100 a month to families with kids enrolled in the school district in a similar way to the SNAP program. And every family with a child enrolled in Baltimore City received one of these cards for their students, and it collectively was about $500. And that was something that families could then use to purchase what they wanted to purchase. And something that was more relevant for their household and individual taste preferences in that family. So that is something that goes a little bit outside of the ready to eat meals that we do serve and the boxes of produce that we do serve. Our baseline focus is to assume that or not assume really that anyone has additional cooking equipment to then prepare stuff. So while we do try to get more produce options available with the Maryland Food Bank in our pantries, and also when we look at produce, just general giveaways, we do try to be mindful that we try to make it as easy for someone to consume what we're providing as possible, because that is a hard thing to necessarily measure.
I would just add that the fresh fruit and vegetable program is the #1 reason for visits to the nurse's office in our health center. Our nurses serve as the distribution site at the school for fresh fruit and vegetables, not the produce boxes, but like the individual sort of portions. And I think that linkage between like you're coming to a health professional and they're giving you fruit is like actually a very important connection in kids' minds, and helps them get engaged in other kind of health and nutrition conversations.
Yeah, and I would just tack on real quickly that within the context of community schools in Baltimore, they're located in specifically high poverty areas. And so those coordinators are working with organizations. I can think of Days of Taste as one, Hungry Harvest, again, local churches. So the people who are on the ground, they're specifically placed in areas of high need that are then working to bring in, these additional resources. So yeah.
Great, and I think we may have time for one more question or comment. And Mira Meda, would you like to make a comment?
Sure. I'm not sure I want to make a comment. This is a very, very interesting conversation, and I just wanted to mention that many of the things that you mentioned are very similar to the efforts that we have in Montgomery County and some other efforts in collaboration with school-based health centers. We get referrals of children from pediatric providers that work at safety net clinics in Montgomery and Prince George's County. Then we deliver family-based interventions to primarily Latino families who are part, whose children visit the school-based health centers. And we offer physical activity and evidence-based nutrition education program. We are funded by the U.S. Department of Agriculture, and I just thought I would share it with you. I'd love to reach out to many of you because we share many of the same concerns and challenges. But we have been doing this for quite a while. We also had a number of grants where we were able to track actual changes in BMIs, physical activity, some actually interesting data as far as weight is concerned as well. But we are really a nutrition education program, and as a routine part of our effort, we do not track weight or BMIs, but we have done it through grant support, separate grant support. But we do track behavior change very, very consistently over time. And we do track changes in, we do have, we do deal with food resource management and track food insecurity as well. So I just wanted to throw that out.
Great. Well, thank you for doing that. And I want to give the panelists just a last minute to make any closing comments before we finish at 11:30. And, maybe thinking a little bit about looking ahead and what you would hope to see in this area in the near future. Maybe we start with you, Kate.
Sure, thanks. Yeah, I think one thing I would add, just because we haven't discussed it overtly yet, is funding for these sorts of programs and interventions. So we heard a lot of people talking about grants. We heard a lot of people talking about funding from different federal sources. I would say that for school health programs, consistent funding that can either be built on traditional sort of medical billing models or can kind of expand that to a more preventive approach, and or ways that, as were suggested, for example, in the Kerwin blueprint legislation, that we might fund programs, not just school health programs, but the types of programs we're talking about that are really serving to support kids and students, and just thinking creatively about the ways to do that, because I think that the lack of a consistent funding source for this sort of work has a tendency to create this sort of like fragmentation, and this year we have this program and next year we don't.
Great, thanks so much. Mike?
Yeah, I would just say that for me, this is a really exciting time for the interaction between community schools and combating obesity and promoting wellness. When I started as a community school coordinator a little more than 5 years ago, there were about 50 community schools in Baltimore, and due to legislation that's been passed over the last few years, there are now more than double that number in Baltimore City, and there are community schools across the state of Maryland as well that are expanding. So there's a lot of promise, and I'm excited to see where this work goes.
Great, and Liz, you get the final word.
Yes, hi. I'll post some links in the chat, but I do want to say for us, we are a federally funded program, and a lot of the improvements that have been made at large to the child nutrition program were done in the 2010 Healthy Hunger Free Kids Act reauthorization, which is supposed to be coming up in the next year. And I would say that it is important that we stress to people the importance of having nutrition standards in the meals that we're serving to kids, and making sure that federally funded meal programs are linked to science and what we know is healthy for our communities, and not what is necessarily good for corporate food profit. So I just want to put that out there, because I think there is a real importance to nutrition standards, and that is a big thing that is not quite out there with everything else going on, but is really important and coming up in the next year.
Great, very important. A lot to go in this area, but tremendous work being done, and a lot of potential for more. So let me thank the 3 great panelists. Thank you all for attending. And Whitney, is there any other announcement to make about the conference at this point?
The only thing is, if you can join us, all the panelists or other people here in a Zoom, to go to the main Zoom conference that we were on before, and I put the link in the chat, and don't forget the passcode.
Great. Okay. Well, thanks everybody.
Thank you.